Well, let's stay with this story. The Health Minister, Dr Aaron Motsoaledi, calling for action against those implicated in this damning report. The Minister himself joining us tonight to react on the release of this particular report. Minister, good evening to you. Thank you very much for your time. It goes without saying that you are the custodian of health and health facilities in South Africa. So in this report, to sum it up quickly, Minister, there are systemic issues, whether you think electricity and, of course, the matters that it has dealt a blow to in terms of these facilities functioning properly. But then there is also the human element where officials simply failed to check vital signs on the patients. Who enforces accountability as to people being disciplined here? Is it you or is it the health MEC in the Northern Cape?
Yeah, Taole, thank you very much. Good evening, and good evening to the listeners and viewers. You will be aware that the office of the Ombudsman was established by me in my first term as the Minister of Health. And when people ask me what is a health Ombudsman, because we have never had such an office in the country before, I then told them that it is the public protector of health.
Yes.
I was worried, Taole, that whenever there are problems in our healthcare facilities, they take frontline news on the media and headlines in the newspapers, and from there the story just disappeared. So I wanted somebody who will have the power to make recommendations, just like the public protector does whenever things have gone wrong. It is for that reason that we moved to amend the National Health Act to put the health Ombudsman, who becomes specific and say so and so, who can subpoena people. Now, having said so, coming to your question, you are aware that health is a concurrent competency. On human resource issues, it is purely the provincial function. We come with policies and standards, but whenever things go wrong, one can make recommendations. That's why I was able to write to the Ombudsman so that he can point directly who is wrong.
Yeah.
Now, if anybody must go through to DG, I don't have any powers as a minister to go directly and put somebody for disciplinary hearing, unless, of course, the province is put under Section 100(1)(b), as we will remember we once did with Northwest. With Northwest now, they are under Section 100(1)(a), which means I can give them instructions, but I cannot do things on my own, like when they were under Section 100(1)(a). Now, Northern Cape is not under any Section 100. All that must happen is that the MEC was there today in the news conference. He was listening, and he will have to do something. What I'm going to do, Taole, I have already informed him. I want to call a meeting next week, and my office is trying to make the time, where I'll also even call the Premier in, call the MEC in, call senior people, and sit down and discuss these issues and what we are actually going to do.
Yeah. And people will be desperate to see consequences as soon as possible.
Oh, definitely.
Minister. Yes.
There's no question about it.
Yeah.
There has to be consequences, because the Health Professions Council will have to also get involved, and the Nursing Council, because, Taole, what disappoints me the most is that most of the cases, like if you look at Life is Demanding and you look at the Health Ombudsman report on Helen Joseph, they usually found problems with management, management style or management capacity. In this case, clinical care by doctors and nurses. When you heard the Ombudsman talking about how pneumonia was treated, today I even said, I never practiced medicine for 30 years, but from what I've heard, I could do much better. So it's going to be important for us to find out how can doctors who are trained, remember, doctors are trained in same institutions all over the country.
Yeah.
How did those ones do what they've done. And my own conclusion is that there is failure of leadership, which even the doctors are not scared of, and they don't care anymore. And really, we must go and bring back good leadership in Northern Cape.
Indeed, Minister, because that's what this government and previous governments have always said, that put people first. Batubili, and time and again, we're told that this is a caring government. But as you referenced, we have seen life esidimeni, and now we are here in the Northern Cape. I mean, patients being bought pyjamas that are so thin that they could not even have helped to keep these patients warm. Let's then move on, Minister, because I want to conclude on this.
No, Pauli, you see, no, I need to answer.
Yes.
That is leadership. I don't think it's fair to say this is a caring government. Yes, it is, but when individuals get out of line, I will have understood if we don't do anything. I mean, you mentioned life is the many. You know the actions we have taken. I called the Umbat again, who was able to find where the problem lies. The person who was responsible was fired. You are aware that we even called arbitration process by former Deputy Judge, Chief Justice Musenege. We even called a magistrate came in to do an inquest. So actions are taken to individuals. Yeah. It is individuals who are doing all this rather than the whole state. And I think we must be fair in that regard and point a finger at individuals and see if we don't do anything about them. We do. Understood. We do. As in this case, that's going to happen also.
Understood. And it's a fair point that you make, Minister. Let's then conclude on this task team that the Health Ombud is recommending be established. To your mind, what is it going to do to help in this space?
Look, as I'm saying, I am going there, Koli, to see exactly what must happen. The team I heard him talking about is a forensic audit investigation, especially in the procurement processes. You mentioned here poor quality, pyjamas and all that. Today, I actually gave the country what's happening in that field. I told them that in Silverton, there is a Department of Labor facility where people who are living with disabilities have been trained, and they are making these pyjamas, they are making linen. 2 weeks ago, I've just called the MECs that they are going to buy all the linen and pyjamas there. And at the end of the press conference, I took the MEC there and I told him that they've got branches. That Labor Department institution have got branches all over the country, except in Mpumalanga. That's the only place where they don't have branches. And I say, I don't understand why MECs and why provinces don't really buy that linen. So I took him there and say, from now onwards, you are going to buy all the linen here because it's of good quality. There are pyjamas of good quality. Everything is of good quality. There's no excuse because we don't even know the company where they are buying this linen from, which is of poor quality. And lastly, you may remember that after Helen Joseph, I told the DG to bring all the HUDs together to find out about their shortages of linen, beds, mattresses, etc. And we've announced after the budget that we are going to buy 1.3 billion rand worth of those things which I've mentioned. 1.3 billion, and we are going to buy 1.4 million articles. And as to where we are going to buy them, I call the MECs and say, well, if this linen, pyjamas, uniforms, I want them to use this Department of Labor facility because it helps people who are living with disabilities. When it comes to bed and mattresses, I told them that the Treasury has already got a transversal tender of companies which have got capacity. All they have to do if they need mattresses and bed, they will just have to look for one of those companies and order. They don't really have to issue a tender. That's what we've agreed with them about how to go about spending this 1.3 billion rand.
Minister, you've already prompted the word tender, and I'd like to move the discussion to a different topic now, and that is the botched oxygen plant tender. 800 million rand nearly got lost. It nearly went into corruption thanks to, I guess, the new Minister of Public Works that came in and decided that he was going to stop things in its tracks. You have welcomed this report, a forensic report, that has found that basically there were irregularities all over here. There's a new implementing agent now. It's no longer the IDT that belongs to the Public Works Department. It's now the Development Bank of Southern Africa. But here's the question, Minister. When you say you're going to hold looters to account, as we say, no monies were lost, thankfully, but you still want people to be held accountable. Who, to your mind, must be blamed for this tender going awry?
Only remember, the story was broken out by the press, actually.
Yes.
We knew from the press, both myself and Minister McPherson knew when this story was in the media. Otherwise, we would not have known. Because this is a project which was going to be funded by the Global Fund. The project that started after coronavirus, whereby the Global Fund realized that the country struggled with oxygen. I'm sure you'll remember that.
Indeed.
Shortage of oxygen. Yes, and they said, let's put plans in some hospitals, and 55 hospitals were selected. And the Department of Health gave the work to IDT. IDT, which reports to the Department of Public Works, to be the one that issues the tender and make sure that the oxygen plants are put up and hand them over back to health. But the media then reported that there's been very serious irregularities. That's when then I discussed with Minister McPherson, and because IDT reports to him, he is then the one who said he must do an investigation. But then I asked him, I said, while you are doing your investigation, I'm worried that we need this oxygen. We don't know how the investigations will take and all that. And this is donated money from Global Fund. Please, I am taking this contract away from the IDT under the Department of Public Works. I'm sending it to DPSA, the Development Bank of South Africa, which is under Treasury. I want them to be the ones who carry on this thing while you are doing your investigation. Whatever findings are there, we will support you.
Yeah.
That's what we discussed with Dean McPherson, and he agreed. And then we started the process of taking over to DBSA. Now, the report has pointed to some people. When I said they must be taken to task, and when I say the law must take its course, it's because certain people have been fingers. You may remember, Taole, that when this story came out in the papers, they were also implicating the DG for Health. A lot of media houses or a lot of articles from the same media house implicated him. And specifically, when Dean McPherson yesterday, Minister McPherson, approached me to brief me, because he did brief me because going to the press conference, I specifically asked him, is my DG implicated? Has he been part of this? And he said, no, the report doesn't say anything about him. And I said, well, I'm very glad in that regard, but those who have found to have done something must be taken to task. Even though we did not lose any money, we did not lose a cent as a Department of Health, but we've been delayed in getting oxygen plants. We've been delayed because now we had to go and restart the contract with the Development Bank of South Africa. Of course, we are happy that no cent was lost. The Department of Health lost no money. The Global Fund lost no money. There's no 800 million that is missing. But the tender went awry, and the Department of Public Works must make sure that they take action against those people, and we support that. But we have started afresh with the Development Bank of South Africa to make sure that we get the oxygens in those 55 hospitals without any controversies this time around.
All right. Minister, I'd like to end the conversation on another topic altogether now. You've seen the protests by some organizations blocking illegal foreigners, and we need to stress the word illegal foreigners, from accessing healthcare. And lately, there is an organization calling itself the Independent Health and Allied Workers Union that is supportive of these protests. From your point of view, Minister, I'm not asking about the legality of what is happening, because the law is clear. What is being done is illegal. But here's the question, perhaps, for you policymakers. Are you talking, have you had a conversation with your neighboring countries about them paying you some money for you tending to the healthcare problems of their citizens?
Well, look, the answer you get all the time, because it was raised, but not in really formal meetings, in informal discussions with some officials in Zimbabwe. They make it very clear that they've never sent anybody to South Africa, that they've never fired anybody and forced them to come to South Africa. So they say if people came there illegally, it's your problem, it's not ours, because we as a neighboring country never sent anybody to you. So they do differ, Taole. The countries differ. For instance, with Eswatini, as far back as 2010, they complained to me that they send people to private hospitals here and they are overcharged. I offered them, yes, and they signed memorandum of understanding with Steve Biko Academic Hospital and Charlotte Maxeke. And when they've got people who must be referred from Eswatini, from their hospitals, that is, if they can't treat a person because he's above their means, they send them to those hospitals and they pay. But those who come illegally, they will tell you that no, illegal people are not coming from us, because we have never encouraged anybody or fired anybody to come to South Africa. That's exactly what they will tell you.
Yeah. Minister, thank you very much, as always, for your time. And time and again, when we talk, I truly appreciate your honesty. The Health Minister, Dr. Aaron Motsoaledi. And perhaps a better phrasing on my part is that these are undocumented migrants.